Hello, it's me checking in for I'm just gonna call it week 27, even though I'm 26 weeks and 6 days. Saturdays are my lazy days, and I wouldn't mind doing my videos then, but, lazy day means I look like crap, so prefer to do it today. So I'm gonna, today's Friday. So, what do I say? It's kind of difficult to do these things every week just because, I guess at this point, 27 weeks, because there's not really too much that's changing. I don't really think anything has changed. Maybe my pregnancy brain farts are getting a little bit worse. Actually, I think that's very true. My absent-mindedness, if you will. No, I lied. There's a few things that have changed. I'm sorry. I take it back. I'm having a hard time getting my shoes on now. Not that I can't touch my feet. I can reach them. It's just really uncomfortable. So I have to sit down and bend my knee out sideways and like pull, like you're sitting Indian style and pull your leg up that way and to put my stuff on. But I've noticed that when I bend over and I'm like, if I'm standing and I drop something, my cat just went upstairs and he's not supposed to be up there. Anyways, I hold my breath when I bend over just because I know I'm not going to be able to breathe when I have a lot of pressure on my stomach. So, I kind of have to like plie and squat at the same time to pick things up, or I'll bend over and I'll kick out one of my legs all the way and kind of move my leg as I bend, like lift it way up in the air. It makes it easier because then I'm not putting so much pressure on my stomach. So I look like a retard when I'm sorry, some people don't like that word. I look ridiculous when I go to pick things up. Put my shoes on and put my socks on. I look pathetic. And when I put my pants on now, same thing. I have to kick my knee out sideways and pull my pants on that way so I don't have to bend over. So having 13 weeks left is kind of scary because I already think I'm pretty big. And it's going to be very interesting to see just how big I get. I've gained 20 pounds. And they told me to try to keep it around 25. Now let's think about this. I didn't gain weight for the first 2 months. At 3 months I gained 1 pound. So I was at 12 weeks. So from 12 weeks to 27 weeks, I have now gained 19 pounds. I don't think the 5-pound thing is going to work. Come on, let's be realistic. You guys can say it, I can say it. That's fine. I'm going to be a McFatty. That's whatever. Totally worth it. And to be honest, in my last video, I know that I mentioned that I had like a heart problem, a sugar rush, if you will. And the doctor told me to eat eggs, which actually, I want to tell everybody, exciting. I don't know if anybody else has read it or heard it, but I've heard it in like 2 different places. Well, I've read it actually, that there's been studies recently done. There have been studies recently done on omega-3s, which have DHA and EPA hormones, or I don't know if they're hormones or vitamins or whatever. I think they're vitamins, yeah, in them. And babies which is really important for brain development. So pregnant women who tend to eat more or take in more omega-3 during their 3rd trimester, because that's when the baby's brain really does a lot of developing, their babies tend to have better cognitive and motor skills. So I have been eating eggs every morning. And so I've been doing that, eating eggs every morning because of that, and because you're not supposed to have carbs, like a lot of carbs. And I like eating cereal and bagels in the morning, and when you're pregnant, that's not good. So I've been eating eggs every morning. I'll do I'll do them over easy. Haven't scrambled them yet because I just don't have, I'm still working and I have to be to work by 8. So, and I'm already tired in the morning. So, I just do like over easy, and I'll just do the eggs, and I'm one of those sickos that likes ketchup on them, and pepper. So I'll do that, or I'll do them over easy and I'll put them on an English muffin. And I just actually went out and bought some Canadian bacon because they're just like perfect for breakfast sandwiches. So I've been doing that, and I've been doing it every morning. Because I really did not like the way that my heart felt that morning that I ate cereal. So I've kind of steered away from that. I'll use I eat it as a snack, but not as a meal. And I try to eat like something else with it. So bending over is getting worse. I'm having, I don't want to say a hard time controlling my bladder. But when I sneeze or when I cough, because I got stuffy again. Luckily, it didn't get too bad, and I think it's starting to go away. It was only a couple days, but like in my 19-week video, I was sick for weeks, which is cool that I feel like I'm getting over it already. But I feel like I may pee a little when I sneeze or when I cough. Which, not all the time, but it's not a very comfortable feeling when you're at work and somebody makes you laugh and you're like, ha ha, oops, you know. So, so that's been interesting, and I've not had any constipation, thank you God for that. I got one of those heart monitors from Target, summertime or something like that, there's 2 headset plugins, so that me and my fiance can both listen to our heartbeat, which right now we can hear pretty well. And I originally got it at 18 weeks, and I couldn't hear anything for about 4 weeks. 4 weeks or so. You could, but it was really faint, and it was really hard to hear it. But now you can hear it pretty well. So that's really exciting. I can actually record it onto the computer too. But it also, whenever you move, it's like doom, doom, doom in your ear, and it's really loud. So, and when she moves too, it does the same thing. Starting to get really tired again and antsy. Work is getting more and more difficult with the pregnancy brain farts and being tired. I'm just exhausted. And I'm really concerned still that my job is going to send me into an early labor, because dealing with pain management patients, people that are constantly in pain and addicted to narcotics. We're constantly doing random urine drug screens on patients and finding out, you know, that they're not taking their pills, or they have all sorts of other stuff in their system that they totally should not have. And so we get yelled at a lot. I got yelled at by a patient today that took a whole month's supply of morphine in 2 weeks, and was screaming at me saying that he can't go without any more and we need to give him more. And I told him, you know, you made a huge mistake. You have an addiction problem, and now you're going to suffer the consequences. You don't have any. You're going to have to wait until you're due. But anyways, so it's really, really stressful, and I try not to bring it home with me, but I do. So I'm thinking that once I get my car paid off, so I only have 2 or 3 more payments left on that I am going to ask to be taken out of work, for the last, 8 weeks or so. So in 5 weeks, I'm hoping, I can be done work, because I really want to go the full, I mean, I know I say that now, the full 40 weeks, because I know that's going to be best for my little princess. So, it's been a really long video. So I'm going to show you my belly and then go, because once it gets to 10 minutes, you can't, and there it is, boop, boop. Front, can't really see much. Okay, great, that was super exciting, and make sure you eat your bananas, ladies, so you don't get like cramps, and I'll check in sometime. Okay, bye guys.